because they might not be ready to receive it.
Edutainment is what they call it nowadays.
Yeah. You have to be able to capture people's attention, for sure. Attention is the conduit through which things enter into our consciousness. And if that's blocked or distracted for whatever reason, you're not going to get very far.
And then guys, also do me a favor. We're live streaming this on YouTube, Twitter, Twitch, Facebook, and Rumble. If you guys have questions for the show, send us a Rumble rant, or have a question for the doc, send us a Rumble rant, and we will definitely make sure that we, answer the questions. We actually have a professional in the house, so you guys can go ahead and get your questions answered. And then can you explain to the audience real fast the difference between a psychologist versus a psychiatrist?
Yeah, I was confused about this before I got into the profession. There's so many terms: psychologist, psychiatrist, therapist, psychotherapist.
Yeah.
The most important distinction between a psychiatrist and a psychiatrist goes to medical school. A psychiatrist is a medical doctor, and because of that training, that person is entitled to prescribe psychiatric medication, antidepressants, anti-anxiety pills, etc. A psychologist is like a PhD doctor.
Yep.
And this person can do lots of different things. Sometimes they go into research, sometimes they go into academia, and sometimes, like me, they go into private practice. They go into psychotherapy. The term psychotherapist is a meaningless term. Anybody can call themselves a psychotherapist. It doesn't have a legal basis. But like, you need to have a license to be a psychologist. You need to have a license to be a psychiatrist. These are like legal professions that require certain degrees and other trainings to
Gotcha. And what is the governing body over all psychiatrists and psychologists in the United States? Is it like the American?
I think for psychiatrists, it'd be the AMA, which is the American Medical Association. For psychologists, is the APA, which is the American Psychological Association.
Okay. And the two don't overlap at all? At all? Two completely different governing bodies.
The governing bodies are completely different, but they're not so separate as I just suggested, partly because psychologists really, really, really want to be a science. And for example, their diagnostic tools are based on, this is kind of in the weeds, but the DSM.
AMA and APA, one is the American Medical Association. That's where psychiatrists are under, and then American Psychologists Association.
You got it. Exactly. Psychologists they get their diagnostic tools from psychiatrists. So there's a little bit of overlap with respect to diagnosis. That psychologists basically use the definitions for mental illness that psychiatry has developed.
So let's say Dr. Jordan Peterson, he doesn't fall under these because he's Canadian, right?
That's right.
So he's a whole different
licensing body. Yeah.
Oh. Yeah. But he's a psychologist.
Yes.
In this. So, he can go into, just like you said before, when you become a psychologist, you can get into research, you can get into
academia,
therapy, academia. Okay. And in your case, you have your private therapy practice that you do, and you still maintain, I'm assuming, right? As well. So what made you segue into the YouTube world? How'd you get involved with that?
Sure. So I had been working as a psychologist in private practice for about 6 years. And as I said, I was specializing in men's mental health. And I had a full practice, and I felt like I was doing a lot of good. Like I could see people were getting better as a consequence of their engagement with me. Not always, but almost always. And one of the things that, it was very satisfying to do that, for sure. But with a private practice, you work with 30, maybe 40 people a year. Now, if you can really change even 30 or 40 people's lives for the better, that's no small thing, right? But I figured that if what I was doing with these guys might be helpful for them, well, they're not so different from potentially millions of other men out there on the planet. So maybe I could find some sort of platform, some sort of conduit through which I can reach all these other men, because if it works for these guys, it might work for all these other guys as well. And so that was really my motivation, is to try to have a bigger platform so that to the extent that I was doing good, that good could reach more people.
Gotcha.
The ultimate mission of the channel is to reduce human suffering.
Yeah. So with that said, what would you say is the current state of men's mental health in the West? There's a lot of people always talk about mental health, but they tend to kind of forget the male perspective on it, right? Because men are taught to be stoic, hold it in, man up, etc. Which we advocate here on the channel, especially in front of a woman. But obviously you should be able to open up and be able to deal with your problems with your brothers, or maybe with a professional that understands. But what would you say the state of men's mental health in the West today would be in general?
I think the state of men's mental health is pretty poor. I think the state of mental health of human beings and their physical health on this planet is pretty bad right now. Absolutely. I think that stoicism gets a bad rap. I remember when you came down yesterday and you broke the news to me about what was going on, I noticed and I mentioned that you seemed to be bearing up very well, and I appreciated your stoicism, and your eyes lit up. Like, there is definitely a time and a place to kind of bear your cross and to carry on. Absolutely.
Yeah.
And the powers that be that want to demonize that or say that that's a component of toxic masculinity, that's just not true, and that's not helpful for guys.
Yeah.
So when they say men go to therapy, I just want your opinion on this. Does that actually work most of the time, or is it more like a, go deal with this and go over there, stay over there?
No, a lot of therapy doesn't work for guys, and that's, I think, partly why they're under consumers of therapy. Like, women go to therapists 3 to 4 times more often than men do.
Right.
They are by far the most significant consumers of psychotherapy. I have my own pet theory for why this is. So let me just ask you guys, what is your association with therapy? What do you think happens in a therapy session?
Well, I've never had a therapy session, but what I would assume is
Even
right,
better. Like, what's your
Yeah.
imagination about
Yeah.
it?
So my imagination is you go in, you sit down, you lie on a couch like this, right? And you're just like telling the therapist your problem. And, you're just lying there and they're doodling in the back. I'm just kidding, not doodling in the back, but you get out saying they're listening to it. They're like, okay, yes. All right, tell me more, etc. And it's almost, it depends on the therapist. Maybe they'll say, hey, this is a solution to it, or hey, let me refer you to a psychiatrist, maybe so you can get some medication, or they're trying to get you to come back for more sessions. I've always been under the idea, that therapy, it's not in their best interest to fix you up, because it's like, no, they want you to keep coming back.
Sure.
Yeah, so though I definitely think it has its place, I don't know if it's a long-term solution to a long-term problem.
Okay, great. So that's a wonderful place to start. One of the things that I mentioned on my website is that therapy should be time limited. Like, sometimes you do have to take a knee, but you do eventually want to get back into the game. Like, I'm not looking for professional patients, people who just want to support my income. There is plenty of problems in the world needing solving. Let's have you in, patch you up, and send you on your way. So, but I hear you. There does seem to be an economic disincentive for therapists to cure their patients, because it's just one less client, right? Okay, your association is like perfect classical psychoanalytic. The patient on the couch, the doctor with the notepad behind him, that's basically what Freud did. And psychoanalytic psychologists still do that today. And they don't really say that much. They just say, I see, tell me more. Oh. And
That's what Fresh does on dates.
That's what I do on dates, man.
Right on.
Wonderfully.
You don't want to talk too much on a first date. You don't
Exactly.
disabuse a woman of her fantasy of you. That's why she's there.
W.
Absolutely. So, and a lot of guys say, okay, I'm just going to lie there. This guy's going to say, I see. And I'm going to pay him $200, $300. How is that going to help my problem?
What's the point? Yeah.
I get you. Now, why did this come to be? This is my pet theory. I'll be brief. So, Freud was a Jewish psychiatrist. He but not back in the day. Back in the day, because of the anti-Semitism in Europe, he couldn't get clients. No men would go to see him. So he basically had as his patients the people that the institution didn't want to work with, which was actually mostly women. And so most of Freud's clients, a lot of Freud's clients were women. And he was an entrepreneur. He was an experimenter. He was always trying new things. And he had this one patient, we know her as Anna O, and she kept coming for a while and didn't really help her all that much. And Freud was trying this, trying that, until one day she basically said, hey, listen, dude, just shut up. Just shut up and let me talk.
Wow.
And Freud was like, oh, okay, I can't see the harm of that. Maybe I'll try this. And so he just sat there quietly. She talked for an hour. And at the end she said, I feel so much better now. And Freud was like, ding, 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 ding. And thus the talking cure was born. But this is a female or a feminine coping strategy. Women tend to feel better when they talk about certain things. When they get it out, it's like the act of talking about it is cathartic for them. Men are more problem solving. They don't understand how just talking and listening will help anyone, because they see the problem as out there. Like, the problem is that I'm broke. The problem is that I have no prospects with women. The problem is I feel lonely.
Yeah.
Like, I need friends. I need to work. I need to get some game. I need something in the external world. Guys are more problem
solution typically to their problem, versus with women, it's more, I just want to be able to speak and get my emotions out there, and that will make me feel a lot better, versus for men.
Exactly.